Hey guys, Dr. Schumacher here with Premier Chiropractic and Performance in Jacksonville, Florida. Today we have a special guest. We have Mia. She is a obstacle course racer and trail runner here in Jax. She competes in a lot of obstacle course races all across the country. She's been dealing with a lot of chronic low back pain, a little bit of hip tightness too, especially when she's running on trails lately. So we've been working with her for 2 years now, I think. But we've cleaned up a lot of stuff with her. We've got her squat form better. She's able to be more efficient in the weight room during her training. Her gait has improved when she's been running. But now she's just dealing with some of that chronic stuff that's off and on when she's trying new exercises or, you know, trying to increase her distances on her trail run. So what we're going to do today is we're going to show you a little bit how we treat some chronic low back pain, especially with our athletes today. And then we'll get down to the rehab room and show you how we treat down there as well. All right, so the first one we're going to get started with is we're going to focus in this low back. This is called flexion distraction. This is a very common one that we use with a lot of our patients in here. We actually let the table do a lot of the work. So what I'm going to do is I'm going to have my hand right here on your low back, just working up. Table's going to swing down and swing right back up. What we're doing is just opening up those joints and trying to get some joint motion into that lumbar spine. How does that feel?
Good. Great stretch.
One more here. Yep. And anytime we're treating an area of pain, just like we were talking about in our assessment, we always look above and below that area as well. So we're also going to treat up into her mid back a little bit here. So we're going to do a little bit of a thoracic adjustment. So we're going to go straight down here, relax those shoulders. So what we're doing here is called side posture. We're actually looking at the sacroiliac joint. This is big, high stress area. This is a joint where our upper body kind of meets our lower body. So what we're doing right here is we're just getting her in a position to lock that joint out, and then we're just kind of resetting that motion into that joint. So on your back. Especially with chronic low back pain patients, it's really important we look what I call downstream. We look at the hip, we look at the knee, we also look at the ankles, especially a lot in our runners too, because this is just such a crucial part during their gait that we have to make sure we have good dorsiflexion in these ankles. So we're just gonna get a little motion in this right one here. You're gonna relax that leg, I'm going straight down. Good. And a little bit left here. So another thing that she was telling me earlier is that she just took a long road trip, and this is something that we see probably in 95% of our chronic low back pain patients, especially if somebody's traveling a lot for work or just came back from vacation, or if they have a desk job and we're sitting for long periods of time. We have a muscle right here in the front part of our hip called the psoas muscle, also known as our hip flexor. It connects in that low back and comes down and goes into our hip. And if we're sitting for long periods of time, this can just become chronically tight. It can pull on that low back a little bit, cause a little bit of compensation issues. So what we're going to do is we're just going to do some compression, some manual release onto this hip flexor with some active movement to try to get that hip motion and that pelvis working like it should. So go ahead, all the way down. Good, and then right back up. Same thing. Open, close, right back up. And last one. Yeah, let's do one more right there. All the way down, all the way down. There we go. Good. And we're just going to get a little Come on up. So how'd that feel?
Good.
Awesome. So what we're going to do now, after we've kind of reset that joint motion, we've told her body, hey, it's okay to move in these areas. We're now going to go reaffirm that motion with some rehab exercise. So let's go down, head down to the rehab room, get some work done down there, and then we'll get you out of here.